6 days until this year's Komen Race for the Cure in Eugene. And tonight we're looking at the heroes behind the scenes in the fight against cancer. They're called nurse navigators.
That's right. They help patients take their first step towards treatment and guide them through the challenges along the way. They not only provide information and clarity, but hope and motivation.
If you can imagine receiving any type of cancer diagnosis, right? We've just plunged you into a whole new world, new language, many doctors and caregivers, and it's really overwhelming.
That's where the navigators come in.
Find out where you are, meet you where you are, and walk you through the process.
Lisa Tucker is a nurse navigator with Northwest Surgical Specialists in Eugene. It's a burgeoning breed of nurses whose sole purpose is to make life a little easier for women diagnosed with breast cancer.
Basically, it's identifying what needs the patient has and then connecting them with the people who can meet those needs.
The journey begins at diagnosis. Navigator nurses like Lisa help deal with the machinery of the system that can be daunting for patients still coping with the idea of cancer. From scheduling visits and surgery to locating counseling and identifying education programs, Navigator nurses work with the patient's families and map out a plan that ends in remission.
Our job behind the scenes is to make sure that the essential appointments for treatment that are going to help take care of the cancer are taken care of.
They make sense of a world often turned upside down.
I understand how you are not only worried about yourself, but many times you're more worried about your children and your family and how you're going to take care of them while you're going through this.
And help find the way through even the darkest times.
When they come to my world, their biggest concern is losing their hair during chemotherapy.
As a breast cancer survivor herself, Katie Burke uses her own experience to point patients in the right direction.
Just being able to understand that feeling and that emotional side, I think is really helpful for the patients.
After diagnosis, patients work with Katie at the Willamette Valley Cancer Institute to tackle the challenges along the road, connecting them to crucial services while providing them guidance and simply someone who understands.
You're giving them hope that you're 8 years from that and there is survivorship and there is life beyond just what you're doing right now.
Between Lisa and Katie, the weight of the unknown becomes easier to bear. While they help patients strive for survival, they provide a companion well-versed in the terrain of treatment.
While you're going through chemotherapy or treatment, you're like, is this ever going to end? And it does end, and you do have a life outside of it.
Navigators helping to reach the end of a long road with a sense of confidence that you're in good hands and moving in the right direction.
My hope would be that they feel very cared for and that they feel like they have a group of people who are in their corner working specifically for them.
Well, both Katie and Lisa are unable to attend the Komen Race for the Cure this weekend, but both say they're always available to go the rest of the way for anyone who needs it. And one thing that impressed me the most about both of those women, and actually everyone in the office, is the humor that is in that office. It's so upbeat and so lively, and they're making everybody there feel welcome, and they're doing just a fantastic job.
All right, very good job.